I'm Karen McLean. I'm a gynecologic oncology physician at Roswell Park Comprehensive Cancer Center, where we take care of women with uterine, cervical, ovarian cancers, as well as less common cancer types. And I'm here today with Dr. Mager.
I'm Dr. Katherine Mager. I'm also a GYN oncology attending here at Roswell Park Comprehensive Cancer Center with the same area of specialty.
And today we're going to talk about some of the most frequently searched questions that you have about cervical cancer.
Dr. McLean, are there symptoms of cervical cancer?
This is an important question because we want you to know what things you should go see your doctor about. And the most common symptoms are bleeding at irregular times. So bleeding between your periods or bleeding after having intercourse, occasionally pelvic pain, but again, with our goal of catching cancers early, it would be this abnormal bleeding that we would really want you to seek medical help for. Okay, Dr. Mager, will you get cervical cancer if you have HPV?
So HPV is a very common virus, and most adults throughout the world, and certainly in the United States, will have had exposure to HPV at some point. HPV is associated with over 90% of cervical cancers. So it's important that we take steps to prevent the development of cervical cancer. So how can we do that? Number one, vaccination against HPV. The second is getting regular pap smears. But while HPV is associated with cervical cancer, just because you have HPV does not mean you're going to get cervical cancer, and the vast majority of people will clear the infection on their own. Is there screening for cervical cancer?
As Dr. Mager mentioned, there is in fact screening for cervical cancer that has really helped decrease the people who develop cervical cancer, the number of people who develop cervical cancer. And so the screening has evolved over time, but now that we have both looking at the cells and looking for HPV, we've really gotten much better at knowing which patients are at higher risk and which folks we can just watch and give them time to clear that HPV infection. What can cause an abnormal pap smear?
So, as Dr. McLean mentioned, there's two components to what we consider a pap smear. You can have an abnormal test because the HPV is positive, but the cells look okay. There can be an abnormal test because the cells look abnormal, but the HPV is negative, or both can be abnormal. An abnormal pap test, again, is not a diagnosis of cancer, and it doesn't always mean a precancer either.
Dr. Mager, before we go on, I have one question I think they might benefit from learning about, which is what are some common and uncommon reasons folks might have a harder time clearing that HPV infection?
There are certain things that can put you at higher risk for inability to clear. So if you have something that impacts your immune system already, either have a pre-existing condition that makes you have a low immune system, or you're on medications that decrease your immune system for various reasons, that can put you at high risk of not being able to clear an HPV infection. Smoking, so any kind of smoking, and then infections with other bacteria, viruses, etc., can also make it harder for your body to clear both. Is cervical cancer curable?
Cervical cancer is in general highly curable, and the biggest control of this is seeking regular care, screening pap tests, HPV vaccination to decrease your likelihood of ever getting cervical cancer, and then catching it early if there is something abnormal going on. But many cervical cancers are curable.